Good morning, everyone. Thank you for coming. My name is Guy Smith, President of the Alberta Union of Provincial Employees, joined today by our negotiator, Kevin Davidjuk, and members of the elected negotiating committee. After almost a year of very challenging negotiations, which came to a head during the February 16th wildcat strikes, I am pleased to announce that we have reached a tentative agreement with Alberta Health Services for our 22,000 members who are the General Support Services workers. These workers are mostly women and they're mostly part-time employees, but they are the backbone of the entire healthcare system. We are proud as a union to stand up for these workers and ensure that they get the recognition and respect that they deserve. Following the wildcat strikes, we entered into a mediation arbitration process. We recognize that the opportunity to negotiate an agreement was there and in this process, and instead of having a binding arbitrated ruling. Alberta Health Services also recognized this opportunity, and both sides, with the assistance of arbitrator Andy Sims, worked hard to come to this negotiated agreement. The complexities of this round of negotiations cannot be understated. Beyond salary and benefit considerations, there were numerous contract language issues that needed to be addressed as a result of the amalgamation of many different regional collective agreements as a consequence of the formation of the Alberta Health Services Board. Therefore, improvements in language were made, including the following key areas, which bring them into line with existing AHS union agreements. First of all, hours of work, regarding scheduling of shifts, provision for consecutive days off, adequate time off between shifts, and shift rotations of no more than 6 days in a row. In layoff and recall, it allows for greater opportunity for the redeployment and reallocation of staff affected by layoffs. Definitions of part-time work will allow the combining of multiple part-time positions for workers who are working more than one position. Classifications have been a very difficult process to deal with, and we've now established a process with Alberta Health Services to conclusively address the many job classification issues arising out of the amalgamation of the various collective agreements. The monetary issues were addressed as follows. There will be an increase in the health spending account to $600. More importantly, this will become a fully flexible health spending account to be used at the employee's choice as of January 2013. Statutory holiday improvements include double time for 2 stats per year, bringing it in line with other Alberta Health Services union agreements. There will be increases in evening, nights, and weekend premiums, again to the level of other AHS union agreements. There will also be a 3% base salary increase for each of the 3 years from April 2011 to April 2014. We are recommending to our members that they ratify this agreement. And we anticipate that the ratification process by mail-in ballot will commence by the end of this week. I'd like to thank our negotiator, the negotiating team, the local leadership and activists, and the thousands of AUPE members who got directly involved in this round of negotiations to bring it to a successful conclusion. I would also like to thank Alberta Health Services for recognizing the value and importance of this group of its employees and for showing a commitment to reach a negotiated settlement. Thank you.